Jennifer Baker, cancer patient. Where are we at with her?
Her arm is set and she's back in normal sinus rhythm. I'm actually looking at her history right now.
Ian?
And she's been through hell the past few years.
Yeah. But a DNR? Is she considering her family?
At this point, she may think it's the best thing. I don't know.
Zoe.
Dr. Halstead, good morning.
I know I was supposed to call you back. I should have. I'm sorry.
I understand you're busy. Hey, S&B has an outstanding new asthma drug. Would you care for some few samples?
No, thanks. Listen, I read a prospectus on a clinical trial you're doing for non-Hodgkin's lymphoma, a radioimmunotherapy drug.
Feltermomab, very promising.
That's the one. Listen, I got this patient. She's tried everything. Nothing's worked. I'm pretty sure she fits the profile for your study.
I'm sorry, but the trial's closed. It's full.
Zoe, this woman is end stage. She's got a kid. I'm looking for anything to give her more time.
I get it, but there's
Just try.
not a...
Please.
Let me make a call to our medical director. No promises, though.
Thanks. Mrs. Baker, I have some very good news. A pharmaceutical company is conducting a clinical trial that you qualify for. A new cancer drug. I was able to get you in. Mrs. Baker?
Sal, can you take Bailey outside?
Yeah. Yeah, sure, yeah. Come on, honey girl. Let's go find something to eat.
I'm drawing.
All right, you can do that when you come back.
Okay.
Oh, thank you.
The trial's oncologist is going to need to examine you. I'd like to set that up as soon as possible.
Sorry.
No more trials.
Mrs. Baker.
You know how I feel.
But this is very promising. A new radioimmunotherapy drug, very similar to tositumomab, which you've done before, but this works.
Dr. Halstead, you're not listening to me. I'm done. I've tried everything.
You have nothing to lose.
Yes, I do. The drugs make me sick and weak and exhausted. I throw up. I'm in constant pain, and my family suffers as much as I do.
But you may react differently to this. It could be a game changer.
That's what the last half dozen doctors said. And yet, here we are.
Dr. Manning?
I think we should let Mrs. Baker rest.
I know you're trying to help. But I can't do this anymore. I want to live out the rest of my life with the people I love. I'm not in a hospital.
We understand. We'll check back later. Dr. Halstead?
Yeah, thanks for the help in there.
What is with you?
Last time I checked, we're supposed to be saving lives.
She has made her wishes very clear.
She can't just give up. My mother died of cancer. If she had access to a drug like this, she might still be alive. Mr. Baker.
Jen's feeling a little nauseous, so Pop usually makes her feel better.
That clinical trial I mentioned, it's really worth a shot. Would you talk to her?
I know what she's gonna say.
This is off the record, but I spoke to the pharmaceutical rep, and she told me they've had some remissions. Total remissions. Please.
You know, I would do anything to keep my wife alive, but you know, she's had so many false hopes. Okay, you know, I'll try. I'll try.
Code blue, treatment 5. Code blue, treatment 5.
Mommy! Mommy!
It's okay. It's okay. She's in a better place.
Did you ask her?
She wouldn't.
She's wrong, Mr. Baker. Let me resuscitate.
Will, she's got a DNR.
She doesn't have to die.
I don't know.
You want her to live. You told me.
No.
I don't know.
Will, don't.
Tell me to resuscitate.
Daddy!
I don't know.
Please,
I don't
let
know.
me try.
I don't know.
Please
Will, don't do this.
Get the cart in here.
Will, stop.
I have to. April, the cart.
No.
Mommy! Mommy!
Now!
What are you doing?
Daddy! Please help her!
No.
1 milligram of epi. Mr. Baker, take your daughter out.
Okay.
No.
Come on, honey.
Will, you can't do this. Will, stop.
I'm tubing her. Natalie, please take over
No,
compressions.
I won't. Don't do this.
Doris, you take over compressions.
No. Will, this is illegal.
I'll take responsibility. Do it.
No.
7.5 ET tube and a 4 Mac laryngoscope.
Yes, Dr. Halstead.
She's still in VFib. I'm charging 200.
Will, let her go.
Clear. Clear!
Will, stop. Stop.
I said clear. Continue CPR. Charging to 200.
Charged.
Clear.
Got a pulse.
Good. Get an EKG and redraw labs, CMP and tropes.
Yes, doctor.
What have you done?
Her heart rate is erratic. Let's watch her O2 level.
She's going to thank me. How we doing? Excuse me, Bailey. I'm gonna check Mommy's heart. Still stable. She's off all blood pressure drips. We can start the process of getting her in the trial.
We just want to be left alone right now.
Here.
Dr. Halstead, Miss Goodwin would like to see you in her office.
Did he tell you to resuscitate his wife?
Her husband wants her in the trial. He agrees with me.
Yes or no? Did he tell you to resuscitate his wife?
No. But he wanted me to.
And how exactly did you divine that?
I couldn't just let her die for no reason.
Well, there is a reason. She has a legally binding document ordering you not to do so.
And don't I, as her doctor, have a moral responsibility that supersedes that document?
No, you do not, and you know that.
Miss Goodwin, she was out of her mind from the pain and the illness. She did not understand what this drug could do for her. I did.
This is not about you. It's about her and what she wanted. You have put this hospital and yourself in an extremely dangerous position. I hope you understand the gravity of your actions. Get her out of the ED and up to the MICU. Dr. Manning will be primary now. I want you to stay away from Jennifer Baker and her family. Are we clear on that?
Yes.